Muko, you're muted. But ladies and gentlemen, we're starting off officially right now. We're just upgrading the speakers so that we can officially start off. Also, just to help facilitate this to be a bit faster, if you do know you're part of the panel, you just raise your electronic hand so that we can upgrade you real quick. Solo, I've seen you. I'm just promoting you to panelist real quick. Muko, can you hear me? I just want to, and Richard, can you hear me? Just want to make sure my connection is good.
I can hear you.
Francis, I'm also upgrading you real quick. Tandy, I've done the same. Onyema, please just, I've done the same, I've promoted you. Welcome, Munya. We were about to send the watch party to you. I was worried that you would not share. Onyema, please also accept that. We want to make sure we start off. My apologies for not starting off exactly at 3. You know how technical glitches don't really kick in. But ladies and gentlemen, I can see over 180 people have joined in. Super excited about hosting this discussion again. Just let me know if you have any difficulties on the text, on the chat, and we will try and rectify that as soon as possible. I'll ask again, do indulge. If you're a speaker, please just use your electronic hand and I will upgrade you as soon as possible. Brian, I've seen you, so I'm just going to send you the request real quick. Welcome, Asia. Super excited to have you here. Welcome, Munya. Just double check that you can hear me.
Thank you, Liz. Yes, I can.
Perfect. Good. And I can hear you. I can see you. Thank you for joining. Muko, are you there? Just want to double check you here.
Lizzie, I can hear you loud and clear.
Perfect. I'm trying to get Muko to start sharing the screen and we can officially kick off. Ladies and gentlemen, as I mentioned, Asia, I can see your hand up. Is there something you want to just double check before?
No, it's just about if you could make me a panelist on both of, I joined from another account as well so that I can share slides from my machine as well. I'm talking to my phone. Sorry about that. That was why I had my hand up. Yep, thank you.
Which of the accounts is that?
So you have me as a panelist under Asia Space Russell. If you could have me as a panelist under Asia Russell or vice versa, whichever one is not a panelist, both should be if possible. Thank you.
Okay, great. Richard, you can help with that? You're both on the panelist, so you're good to go. Thank you for joining. So ladies and gentlemen, as I mentioned, my apologies for taking 5 minutes of your time. We're super excited about having this discussion. We're just making sure we have everything on site. I've seen most of our panelists are here. We're just upgrading 2 more and then we kick off. I've seen we have over 240 people on this call. And we know why, because this is a very crucial time for us to have this discussion and we're just looking forward to, starting off officially. Muko, please double check that you can hear me.
Yeah, can you hear me?
Perfect. Do you mind? I got worried. I was about to send this such pity, but do you mind just projecting and then we can officially kick off?
Okay, let me see.
Yeah, ladies and gentlemen, Muko is here, so we're good to go.
Let me
Perfect.
see. Is it because it's
Slideshow.
like
Next to share.
how do I get the slideshow now?
Next to share. You've seen the button next to share? Even slide, yes. And we click there, even where you are, yes.
Okay.
Perfect. I got worried, but you know what? I like it when we have technical glitches. Good afternoon, ladies and gentlemen. Good morning. We're going to officially record this session. So, Richard, if you would actually, perfect. We're even recording as we speak. So, welcome. As you know, my name is Miss Lizzie, for people who have met me before, and I'm going to be your moderator for today's session. And the reason why we're having this emergency webinar, it's because the PEPFAR bridge planning is ongoing. And of course, that is to just ensure meaningful civil society engagement, but we're seeing that that is not happening. So for the next 90 minutes, we have experts who are going to talk more about that PEPFAR bridge planning, what that is, what we need to know as civil societies, because we're worried about inclusion. And we will focus on the bridge planning, which is a strategic planning effort within the US PEPFAR designed to bridge, that's the key term, or transition the long-term management of HIV/AIDS programs and services from PEPFAR-led initiatives to local governments and organizations. Now, that means we need to be involved with civil societies like community groups, but we're not seeing that happen. Now, a lot of background information is going to be shared by the key partners who are here, who already have a lot of data on what this actually means. But just to give you a snippet, on September 5th of this year, so PEPFAR launched its rapid bridge planning phase. As I mentioned, an accelerated process to set progress priorities through 2026, put everything in right.
Please,
yes,
kindly
I can hear you.
guide me to when to.
No worries. Yes, I will definitely send you next slide. No worries. So this is just the introduction. Yes, so as I mentioned, across Africa, key population, grassroots advocates, civil societies are reporting exclusion from this process. And that's why we're having this emergency discussion. Now, why are we here today? We're here to unpack what this bridge planning process looks like, its steps, hear firsthand country experiences, of which you have people who know what's going on ground, and also strategize urgent advocacy actions from the people on this particular phone. Now, our shared goal is clear. No plan is complete without civil society communities involvement. So with that, let's get started off. So next slide, Muko. Now with that, this is how we're going to spend the next 90 minutes. We're going to do the opening remarks, of course. I've already blubbed everything out, but the main presentation is going to come from Asia, who's on the call, just to give us more understanding on what this bridge planning is. But then we'll open it up to country experiences, where we're going to have Donald Tabayo moderate that particular session. And then we'll go to the third session where Richard Muko will open it up for everybody to discuss what's going on. Now, next slide, please. Great. So these are the photos of the speakers. I will let you second guess who's who, but as we proceed, you will get to kind of have a name to the faces that we're projecting. But these are the speakers and the presenters who are going to share more information around the PEPFAR bridge process. Next slide. Now, without wasting time, of course, I'm going to hand it over to, I've already given more basis around this. I'm going to give it over to Asia. Asia, over to you. And ladies and gentlemen, please feel free to type any sort of concern, any questions, what you're hearing around this particular process. How are you, getting involved, etc. Asia, I know you're on the call.
I am.
Perfect. There you are. So over to you. Super excited and curious to know what's going on. Over to you.
Let me try to share from my side. Hey, everybody. My name is Asia Russell from HealthGap. Thank you so much to everyone who's introducing yourself in the chat. That allows me to see who's on the call because this is a webinar with almost 300 people. So I'm at a disadvantage and can't see your faces or see who's there, but it really helps because this is actually a family meeting, to be perfectly honest. Even though it's 300 people, it's a family meeting, and it'll become abundantly clear why I'm saying that And I'm actually going to turn on my video as well. Apologies, I'm at a meeting in Geneva at the moment, so it sounds a little echoey. Hi, everyone. Okay, so I'm just starting to share now. All right, sorry about that. So as Lizzie mentioned, we're here today to talk together about how to respond to the latest information about PEPFAR's twists and turns. And one thing that's catalyzed this discussion is the fact that we were leaked the so-called bridge planning document, which is actually a 3-page internal US government document, which is just a testament to how horrible this situation is, because as everyone knows, typically a process of planning with PEPFAR has involved at least some minimal engagement with other stakeholders, activists, civil society, government, implementers, as recently as 2024. And that's because of everybody's pressure over decades. So what we see right now is a big shift in terms of process, which is probably not surprising considering this administration. But I'd like to talk a little bit less about process and more about consequences for programming and how we can use flaws in both of these, on both of these tracks, hopefully to change outcomes. Because of course, we're activists. We don't just want to document that this problem is happening. We want to try to change it by shining a light on it and using all the power and creativity that we have to fight for what's right and for what's needed. So I just have a few slides, and if it's okay with the other moderators on the call, I'd actually like to open up the chat while we're talking so that it's a little bit more interactive, and you'll see what I mean in one moment. You can imagine, we were leaked these documents just a few days ago, and they're available on this website, and we'll upload other documents too. Apologies, they're not on the PEPFAR Watch website yet, but everything we receive we'll share. And as you can see, if someone's able to cut and paste that link and put it in the chat now, people can follow along, but I'm going to walk through the document. It's very short. That's part of the weakness. But the benefit is we can kind of go through it together in real time and unpack the threats therein. Then there are some country examples that we know about from Zambia, from Kenya. Maybe there are others that people are aware of too. Unfortunately, what I'm hearing, when we're trying to collect evidence about country planning right now, the first thing I'm hearing from activists is, well, we haven't been involved at all. No one shared anything with us, even contacts that had been trying to keep people informed on a private basis. And that's because the Trump administration, PEPFAR under the Trump administration, is treating this effort as a very sealed and private and internal process. Perhaps that's not surprising. So this is what the bridge plan looks like. That's the first page. Sorry, this is the second page. And can people hear me? I'm sort of on the sidelines of a meeting. If there's any audio problems, it's just
Loud and
okay.
clear. Okay.
Cool. So think when you're reading this about PEPFAR in Washington, essentially communicating this out to other PEPFAR implicated staff in Washington, in Atlanta at CDC, but also at the country level. That's kind of who the audience is. And this is not a public document. I mean, now it is because we've made it, but whatever. So from the introduction, you can see they're talking about ensuring that there aren't breaks in life-saving HIV service delivery, and that they're focused on a 6-month so-called bridge plan. Now let's pause already. There has to be some kind of planning process. It's kind of weird for them to say that this is all focused on trying to avoid life-saving interruptions in life-saving service delivery. As people can recognize, disruptions in service delivery that have happened so far have been because of the decisions of the Trump administration. So the administration decided to carry out a chaotic and life-threatening stop work order. There have been funding freezes, funding cuts, award terminations. So they've created a catastrophe. And right now they're saying, well, what we're going to do is make a planning process, just like normally would happen for this fiscal year. It's fiscal year 2026. That starts October 1st, 2025 and extends to September 30th, 2026. But instead of the normal 1 year period, they're saying, let's do a 6-month period and let's focus on continuing life-saving services. So as you continue to read this memo, you can see that it focuses on the content of that so-called waiver to the stop work order that was published by the State Department in January as well, is artificially limited focus on treatment, testing, PMTCT, and PrEP only for pregnant and breastfeeding people. So we'll unpack all of that in a second though, because there's more there than meets the eye. You can see where adjustments are necessary. Programming decisions will prioritize meeting country needs and maintaining highest impact life-saving services. These phrases are important. We need to use them for advocacy. However, they're also mentioning they want to see quote unquote minimal changes to programs. So that means you can imagine a lot of what they've cut away, they'll probably be watching to see if it will come creeping back. The second paragraph set is about budget. This is very important. People probably remember from PEPFAR advocacy efforts that every PEPFAR country or region or so-called operating unit or OU gets a budget envelope for the year. They are delivering budget envelopes in secret it's secret from us, not from US government staff, to countries. Also, one assumes ministries of health know, although I haven't had the chance to do, sorry for the background noise, to do reconnaissance. Maybe others have that kind of intelligence. So the budget levels have been communicated to chiefs of mission, you can see here. Sorry, just people walking by. Budgets have been communicated to US government chiefs of mission. Many of us have contacts within COM or chiefs of mission offices. These are very important now. The next line is also important. The budget levels are supposed to track for 6 months. What we've heard from a few countries where we've been able to get answers to the question, what is your budget envelope, is that it seems very much like it's not a budget envelope based on congressional appropriations from fiscal year 2025. Sorry, it's confusing. PEPFAR programs based on the prior year's budget. So as people might remember, Congress fully funded PEPFAR for fiscal year 2025, despite the stop work orders, the funding freezes, that affected a lot of FY24 funding. And indeed, because of everybody's pressure, PEPFAR was actually protected from something called rescission, which would have taken away $400 million of FY25 money. We fought that back and we won. Guess what? That has not made the administration very happy. What the administration wants is a shrinking of PEPFAR's budget to about $2.9 billion. That might sound like a lot of money. PEPFAR covers, however, dozens of countries and several regions. It's an annual budget of about $4.85 billion. So you can see that's a contraction of about 40% that the administration wants. So when Congress has been pushed to kind of hold the line and say, we want the program to return to normal, the administration has said it doesn't like that. So the reason I'm communicating this is because, as you can see from like paragraphs 2 and 3, this document refers to the president's proposed budget for FY26. And in fact, and that's that reduced budget of $2.9 billion, which would be further cut in half for a 6-month period. Importantly, the president's budget proposal for FY26 should have zero bearing on this planning process, at least in terms of budget. Why? Because Congress is supposed to have supremacy over budgeting not the president. And that's exactly what's at stake here. What's at stake is PEPFAR's ambition, PEPFAR's fidelity to data, to evidence, to community demands, PEPFAR's transparency, all of those things. But what's also at stake is, unfortunately, a bigger constitutional crisis that the US is in right now, where the president wants to have supremacy over everything, including the so-called power of the purse. So PEPFAR, through no decision of its own, is getting caught up. And so that's why we need to fight even harder. Because even though the president is pushing very, very hard, that doesn't mean he gets to win. Bridge plan development then gets described in the bottom part of this document. It's essentially an instruction that state, CDC, Department of Defense, the so-called interagency, is supposed to use the baseline operational plan as a starting point and then basically hold the line against that. Now, of course, this baseline plan has in many countries been shredded based on what happened when awards were terminated and when funding cuts were meted out between January right up to June and July. And they're really emphasizing so-called simplified process. Now, of course, the process has to be simplified because they've created a completely unworkable timeline. And we'll get to what the timeline is in a second. I want to pause for a second. If there's any like burning questions, sorry, because these are the last 2 pages of the document.
Yeah, I think if you carry on and then we can
Cool,
take,
okay.
yeah, that would be awesome.
So you can remember that last paragraph of the initial page was just about how PEPFAR staff should talk to each other about this and what their so-called streamlined process should be. Essentially, you're going to be running around trying to complete this. That's kind of what it boils down to. And that's what is happening behind closed doors in country capitals right now and in Washington, D.C. It does indicate that teams are supposed to communicate to host country governments, civil society, and multilateral stakeholders that efforts are focused on this internal planning to ensure no breaks in implementation. Of course, breaks have already occurred. People have experienced them on the front lines in the trenches. So this really sanitizes those catastrophes. External engagement will be an important part of longer-term operational planning that US government officials will undertake in the coming months, it says. GHSD will also convene one meeting with each PEPFAR operating unit, so with each country, prior to the submission to discuss the progress. So that's like a quick check-in to address questions, et cetera. We know in some countries this is already underway. And then here's the timeline. So right now we're at the sort of in the middle, because the deadline for submission is less than a week away, September 24th. Then GHSD is supposed to review in Washington. And then everything's supposed to get approved September 30th, which is, the end of the fiscal year. We also know something called, and maybe Brian will talk about this too, one congressional notification. It's basically like a notice from the State Department to Congress about how resources are going to be programmed for fiscal year 2026 for PEPFAR has gone up. Well, multiple have, but a more substantial one has gone up, I think of $1.4 billion. So some money is supposed to be moving. But again, our very limited analysis is that for this 6-month period, what would be on track expenditure of funds would be 1/2 of 4.85 billion. That doesn't seem to be what's getting out the door. Why do I say that? Because as people might have seen from documents we leaked to the New York Times, Emily Bass also wrote a Substack about this, but the materials are now up online in US government databases. PEPFAR is basically has a chokehold of about half of its budget, thanks to something that the administration is doing that's highly irregular and we would say illegal, which is essentially refusing to transfer appropriated PEPFAR funds to PEPFAR's bank account. So the desire of the administration is clear. It wants to shrink PEPFAR. It wants to focus on interventions that it cherry picks. And I'll get to some other developments as well about simplification of the process and why that might be happening. So between these three elements, the shrinkage, the focus on transition, on sustainability, which can have some benefits as well, of course, but most importantly, the administration has said over and over internally at the highest level that it wants to see the program reduced, kind of in and of itself. In fact, there was a preliminary plan that we also leaked to the New York Times that said that PEPFAR essentially was supposed to write a plan for its own termination. So you can see the president wants a sort of writing on the wall, well, not the president, but his henchmen, which shrinks the program, when in fact, PEPFAR has never enjoyed more political support among Republicans and Democrats on the congressional side. And that's in part because of the backlash against the stop work order, the funding freeze, et cetera. So we have to use this tension and conflict to our advantage because there's so much at stake. So the last part about the planning document, sorry to switch back and forth, is on the right-hand side. You can see the quote unquote package that country teams are supposed to pull together. These might be familiar to people. These are the target setting tools that PEPFAR requires country teams to prepare, so requires US government staff to prepare, that determine treatment, prevention, care, indicators and targets, as well as budget levels associated with those plans and activities. But as you can tell, this is a 3-page planning document. There is no substance, no specifics here. And we need to find a way to use that to our advantage, even as we're gathering more data and responding to it. I wanted to share one other document just as an example. We were able to see basically an envelope, the way it was communicated to Zambia, of $117 million for this only 6-month period, communicated to the ambassador, the US ambassador to Zambia. My understanding is typically this document for any PEPFAR Watch alums and others who've been involved in PEPFAR accountability work, this would be accompanied by something called a planning level letter. Our understanding is that those other materials, at least they haven't been shared with us or with the person who shared this with us who works for PEPFAR. Our assessment is that this 117,000 is essentially a 50% cut. The way we determined that assessment is because we looked at the last envelope year for the OU of Zambia that was normal, essentially that was COP year 2 for FY 2023. So you remember Ambassador Nkangasong switched planning to a 2-year cycle. So COP year 2 COP 2023 year 2 would correspond to FY 2024. The initial envelope set for Zambia for one entire year was about 4 times this amount. So you can see Zambia is being expected to absorb a substantial reduction across treatment, care, and prevention without any ability to do that without disrupting essential programs. Now, Zambia, of course, has experienced massive program disruption already and has, good folks have tried their best to prevent harm in those contexts. But there's only so much that one can do. And this involves further cuts than even, is my understanding, than even what Zambia has already absorbed. Kenya, importantly, got a different or an additional communication. I haven't seen the envelope for Kenya. Maybe others have at this point. We'll have a moment during the call to share intelligence as we strategize together. What it did get is a 21-page document that is much more highly technical and detailed than what we've seen for other countries. It could be that Uganda has this as well. There is a subset of countries that it seems like State Department staff are paying closer attention to. And I think we need to use that as a crack in the door to get them to pay attention to all countries, including countries that maybe they think they can just sweep under the rug and transition quickly, even if more is needed, and even if sustainability efforts are premature or will be prematurely carried out, particularly for key populations and other most vulnerable and most at-risk populations, or in country contexts where domestic resources are quite simply unavailable to take up essential services. So Kenya's 21-page document goes into some detail about waiver-supported activities, but also extends a little bit beyond those as well and talks about some prevention efforts beyond only pregnant and breastfeeding people to include others at high risk of acquisition of HIV. So that's incredibly important. And again, we need to build out from that. That shows that pressure can work and that this is they very much want a one-size-fits-all approach, but there's a way, I hope, that we can fight to win something that's different from that. And again, let's all remember, the budget is there to fully fund the things that communities demand. The obstacle is political will and a willingness of the government, of my government, to embrace illegality and an anti-science approach. So it's a huge barrier, but just to say, the money is there, and Congress, to a certain extent, has gone out on a limb to say that it wants this program to return to normal. So we've talked a little bit about the guidance itself. And we've talked about some of the political pressures from Washington that are poisoning this process and that are also shaping this process. I wanted to focus a little bit on something Lizzie was bringing up, which is our goal in describing some of these concerns. And this is for discussion by, oh, now we're up to 360 people. That's incredible. These are the goals that I think as an advocacy organization that's been working to hold PEPFAR accountable since it was created, these are some of the goals that come to mind for me. I think we want to expose weaknesses and harms from this effort. Sorry for the typo. We want to use our power and creativity and evidence to win concessions. We don't have to accept this process, even though we basically have a week and a half to fight back. We want to change outcomes by holding Congress accountable for the pledges that it's made and for its authorities under our Constitution. And we want to hold PEPFAR and the State Department accountable too, because we know there are allies in PEPFAR, as well as people at the highest level of PEPFAR leadership, Becky Bonell, her deputies, that shouldn't be doing this. They should be objecting to this, and they should be pushing back publicly, and they should be using us, much in the way that comrades from CDC eventually decided to speak out, push back, and even resign. Finally, we need to document. Oh,
sorry, Asia, just give me a heads up about time.
thank you so much. And then we need to document harms from this approach, because we may have a setback here. I hope that we will win, and we will be able to use this emergency period in the midst of this untenable bridge planning process to fight and get concessions. Even if we don't, we must document, because this will not be the situation forever. Their objective is to try to undermine the program further and to try to limit it. If we believe that PEPFAR should still exist on multiple prongs, not only on the provision of commodities, not only around PMTCT, but around a comprehensive delivery of evidence-based, human rights-based service provision, then we need to document what's happening here, push for that, and also dream of a time when this administration will not be in place and there will be other decision makers in Washington, D.C. as well. So we'll talk about what you've heard during the additional panels that we'll have, and I'll just wrap up with these final reflections. These are additional screenshots from webinars that were taking place just a few days ago across all PEPFAR countries that give you a sense, again, of what's at stake. You might remember PEPFAR under Ambassador Nkengasong was also restricting its own community engagement, something that many of us criticized acutely. And That was separate. That was during the Biden administration, separate from this administration. Troublingly, another channel of this bridge planning process is a massive cut in the number of indicators against which PEPFAR will be setting targets. Now, on the one hand, there's good news. They will be setting some targets. But on the other hand, it seems like this process of slashing what it's selecting is so rushed and so unaccountable to all of you that we fear there'll be huge intended and unintended consequences that will undermine the effectiveness of programming. For example, we can already see on this slide right here, KP bridge planning indicators will no longer be there. That's because of politics, but not even having to argue against that or stand up for that is incredibly disheartening and disturbing. Importantly, this so-called simplification of OVC targets will also, in our assessment, potentially undermine the quality of OVC programming. The program has been, the intelligence that we've received, they've been very proud of the fact that they're massively slashing quantification targets, in this case in Uganda. But what does that mean for us understanding whether clinical and prevention, care and treatment and prevention implementers are actually delivering against the targets that are set? Because, and this is, Lizzie, I know you're checking me on time. Is that what?
Yeah, I'm about to mute you.
Because, sorry, please don't mute me. This is very important. Because as we know, that for which there is not a target in PEPFAR very rarely gets tracked. So you might have seen from Emily Bass's Substack, I think like yesterday, and this is what we've heard as well, there'll be a lot of reporting still. It's not like because there's not an indicator, there won't be maybe some data collected, but I am very skeptical that these administration teams, which now have SI people, strategic information people, purged, they're much smaller. Just because they're gathering information about it doesn't mean they'll give a damn about what they're finding, because they're not having to report it back against the indicator that they've agreed on. So this is extremely concerning as well. So this is the final slide. I think we really need.
We have the other session and we're running really low.
Oh, sorry, but hopefully this is useful information. So these are some practices for our discussion as a team about what we can do to change some of these outcomes. Chief submission are key, diplomatic staff are key. Get as much information as possible from everyone you know. Take them out for coffee, for beer, for a glass of wine. Get them to talk to you about what is going on. Document everything. Do not assume because they want to continue only waiver supported programs that that's the only thing that's possible. None of this is written in stone. None of it has been passed in law. It's all subject to pushback, concern, to carrots and sticks from all of us. Thank you for your attention.
Thank you very much. I mean, that was intense. I wish we would have just reserved like 2 hours for this particular webinar, but we can't see that. Now, I appreciate Asia's input. Thank you very much, because that actually leads into the next part of this discussion. We want to know is what is happening in countries, and we want to figure out how can we move forward. And yeah, thank you for those tips on how we can advocate. Of course, always taking them out for coffee at the chat tour. But ladies and gentlemen, as I mentioned, this is a 3-part hold. We just finished the first part. I was your moderator for that. I'm going to hand it over to Donald, who's going to take us through the second session. Well, now we hear from the speakers. Donald, are you in the room? Just double checking if Donald is already here. Yes, Donald.
Yes, yes, Lizzie, I was speaking on mute. So thank you very much, Lizzie, and thank you very much, Asia, for the presentation. Very eye-opening. And without wasting much time, I'll invite Francis Luole. I'll invite Tandim Sukuma. I'll also invite Miarazi Chimwara. These 3 country coordinators from campus countries, which is Zimbabwe, Malawi, and Tanzania, respectively, just to share their experiences in country around the current bridge process, what is happening, what is not happening. So I have 3 questions that I'm asking to these 3, and I want in 5 minutes each of you guys to respond to these questions. I know all of you on the call. Most of you know me. I'm Donald Tobayo. I am part of the campus program support team, but I work for Joint Alliance Welfare Organization as the executive director. So we'll start off with Francis Luole from Tanzania. Can you give me a description of specific steps and timelines and nature of the PEPFAR bridge planning process in Tanzania and community and civil society engagements? Secondly, if you can also respond to 2 most critical advocacy actions CSOs in these specific countries must take immediately to ensure community voices and priorities are included in the final plan before the 25th September deadline. And lastly, in case you've developed a specific country community plan, like the CSO country life-saving plan, like a core package of care, like a key population COP. Can you please unpack how these plans or how they will be used to make sure communities' priorities are part of the new PEPFAR plan? So I'll start with Francis, and then quickly we'll move on to Tandy, and last but not least, Munyarazi Chimara. So 5 minutes each. Over to you, Francis.
Yeah, thank you very much, Donald, and hello everyone. I hope you're all doing good. Yeah, so to start with our first question. So to summarize the situation in Tanzania, I can say up to this moment, the CSOs and communities have not been engaged in the ongoing PEPFAR bridge planning process. And to be sure about this, as a coordinator, I reached out to a number of previous COP representatives, leaders of the networks of most impacted populations, and specifically the network of PLHIV, the KVPs and young people, as well as those who were proactive in the technical teams in the previous years where we were developing together the people's COP documents. And I specifically checked with these people because I assumed even if there is limited slots to engage in this process, these are the ones who would most likely have been contacted, you know. But unfortunately, none of them have been engaged so far, and only a few are even aware that this process is happening. And for the few of us, thanks to Emily Bays for putting together that article, and also the team who organized this webinar we're having today, because just from the invite, that is where we were able to know about the deadline as well. So in our capacity, we've tried to reach out to our country coordinator for PEPFAR, but she has not yet responded. However, one of the CDC staff member did confirm, though it was from an official conversation, that a budget envelope has been received in Tanzania. Now, moving to the second question about the 2 critical actions that need to be taken. From my experience, there are 2 critical advocacy actions that I think as CSOs we must take right now so that we can ensure our voices and priorities are reflected before the deadline. The first one, we need to do everything possible to first access the budget envelope in our respective countries, as well as the draft plan that is being finalized, like what was shared by Asia from Zambia and Kenya. And that may mean you may contact your PEPFAR country coordinator from your countries, or you can also reach out to the government officials who have been engaged in this process, whoever is just most likely to respond quickly. And the reason is simple, because we need to actually see what has been prioritized in our respective countries. And also we need to identify what or which essential community interventions are missing out. And also for the second action, I think because we may not, considering the limited time we have, we may not be formally engaged in the process, but we as CSOs must urgently consolidate and put forward a short and a sharp list of community priorities. And if we get to see the drafts from the first action I suggested, we can use it actually to check what is missing and focus only on what is missing. But if we don't, we can still go ahead and put forward what you know is essential, but we need to back it up with a strong justification. And also we need to share it with our relevant government departments, as well as the PEPFAR country team. And in fact, in countries where they already have these CSOs minimum package for health, I think this process is even much simpler, because it's just the matter of pulling directly from your document those essential and important interventions. Yeah, so these two actions are, in my view, the most immediate and impactful things we can do before the given deadline. Now, to finalize about the development of the minimum package for health, the whole idea for us of developing these
1 minute left.
Okay, Donald. Yeah, so the whole idea of developing a minimum package for health was to prepare ourselves for moments like this. And in our case, we even went as far as categorizing those critical community interventions into 3 tiers, looking at what are essential and what is important, as well as what are the additional interventions. And it was a joint process in our country. It involved all the members of non-state actors through the survey that was circulated. And the reason is because we want to ensure that as CSOs and communities, we always speak in one voice when we push for our community priorities, depending on the funding, different funding scenarios. So even though the process came up without notice, but this does not leave us empty-handed, because we have the documents in place. So what we need to do now is the country, we are just going to share it with our government officials, as well as the PEPFAR team, so that at the very least, they can be able to include those interventions that we've categorized under essential and important services. Yeah. And to add, it's not just a listing of interventions. We also have put a strong justification for every intervention. Thank you very much, Donald.
Thank you very much. I was about to tell you time up. So thank you again, Francis. Important conversations. You have received the budget envelope. You've reached out to the coordinator, but no responses yet. You've prepared community priorities through the core package of care. Well done. Can I quickly move on to Tandy? Tandy, you guys were voting yesterday, but I hope the voting process is done and you're moving on. So again, the 3 questions, Tandy, in 5 minutes, can you tell us the situation in Malawi? Over to you, Tandy.
All right. So good morning, good afternoon, everyone. Safe to say we had peaceful elections, and yeah, we're now counting the votes and everything. So from Malawi, it's not as different as Tanzania. I reached out to a couple of members, and none of them have gotten contact from PEPFAR either. And some don't even know that this process is happening. But lucky for us, just like Tanzania, we also started our minimum core package of health services. So we had consultation meetings with different constituencies like adolescent girls and young women, people living with HIV, and other CSO representatives. And from that, we sort of got a picture of what people are prioritizing. And then we incorporated that in our minimum core package. So basically, this core package was just to help us in setting the tone on when we're having our different engagements with PEPFAR. So moving forward, what we've agreed as a country is we will come together, we'll convene agreement, we'll just ensure that the core package and core interventions that are life-saving, that are in line with PEPFAR's goals come together, and then we can present that to ensure that by the time they're submitting it on the 24th of September, our priorities as a country and as communities are actually taken on board. So without going around in circles, that's what we've done as Malawi, what we're currently doing, and we'll provide feedback on how everything goes once we've had that engagement. Thank you, and over to you, Donald.
Thank you very much, Tandy. You've saved us a bit of time. And yeah, most people don't know what is happening in Malawi around this PEPFAR process, but you've also developed the minimum core package of care, which is an advocacy tool as you engage. And you need to continue knocking on PEPFAR's doors to ensure that they unlock the space for CSOs and communities. Last but not least, can I invite Munya from Zimbabwe to share the Zimbabwean experience? Over to you, Munya.
Good afternoon, colleagues, and good morning to those that are beyond our continent. I think this situation in Zim is similar to that of Tanzania and Malawi, especially with regards to the very little known by CSOs and communities around the PEPFAR bridge planning process. Fortunately, in the last 2 weeks, one of our CSO leaders reached out to PEPFAR to try and get an understanding of what is happening. And they were advised that PEPFAR country coordinator who had been attached to the country team had since left. So as we speak, the Zimbabwe PEPFAR country office does not have a coordinator, which makes engagement very difficult because we cannot do any work in the absence of that coordinator. Then secondly, moving on to question 2, I think what is critical for us to do as a country, especially given the USG SWO, is to do a country context. We need a situational analysis that looks at our gaps and the many other aspects that speak to health that we might need to address. Then we will then quickly need to identify country priorities. But whilst we are at that, and this next point speaks to the question 3, is that Zimbabwe had undergone a process of developing a core package of care, which was a response to the work stop orders. And ideally, for me and for many who were working on this important document, is that this can then be critical in identifying priorities for the PEPFAR bridging plan. So I think it's important as we go forward to make sure that we are able to go back to the issues that are in the core package of care and then try to harvest as many as we can in line with the bridge planning process expectations. So in a nutshell, we are still, like, as I was sitting here, I've tried to text also the director for AIDS and TB unit in the Ministry of Health to hear if he has received anything. I've also been in touch with someone within PEPFAR to try and understand if we have a budget envelope. We are in the dark, so to speak. And I think it's important that from this webinar here, we can then allocate timelines and specific points to focus on that we can then push to make sure that we don't leave communities behind. Thank you, over and out.
Thank you very, very much, Munya, for that feedback. The absence of the coordinator is affecting engagement, though you have reached out. The core package of care is in place for ongoing advocacy and the need for continuous engagement with ministry and other partners to continuously engage so that civil society and communities are not left in this space. Colleagues, allow me, before we get into any plenary session, allow me to move on and invite Solomon Wambua so that we hear the key populations aspects in terms of the same questions, any description of specific steps and timelines and nature of the PEPFAR bridge planning processes in countries and community and CSOs engagements. 2 most critical advocacy actions CSOs in countries should take before the September 25th deadline. And then in case there are key populations, community corps, or any related advocacy documents that are in place, how you envisage use of these. So I'll start off with Solomon Wambua and then move on to George Ndukwe, and then last but not least, Kennedy Mutale. Solomon, over to you. The mic is yours.
Yes, thank you so much, Donald. You can confirm if whether I am audible.
Yes, you are.
Loud and
Perfect.
clear.
Okay. So in terms of the key populations engagements, I am solo from Kenya, working with the Key Population Consortium of Kenya. And right now, what we are actually seeing, of course, there is the changes in the staffing of PEPFAR, that is the CDC, USAID, staff have gone, and also now the merging of new offices coming up. So as key populations, we have actually seen that our PEPFAR coordinating office has been merged with a larger health department. So today they were having a meeting, and this meeting was called upon by the former PEPFAR office. So in that meeting, they were actually being told about the present bridge planning process, the processes that will actually continue, so how they will be. And right now, that office is actually under the foreign assistance. So for all of us as key populations or as communities, we need to know which office is actually handling our situation. So at least for Kenyans, we have known that the office has been merged and it is under the foreign assistance. The other thing is that right now, the planning, as key populations, well, we haven't been, told you can bring your views, but you're actually saying, can we actually put in our voice? So what we are doing, or what we are seeing is that the waiver is for 6 months. The waiver actually will ensure that treatment services are not disrupted, but in all this treatment access, the bit about prevention is not there. And we know as key populations, we are mostly, our program is heavily a preventive program. So actually that means that most of our programs will not continue. They will continue only apart from the service delivery component, but looking at the issues of peer educators, those ones are not there. Then at the end of the day, we are also looking at, with these 6 month support, they are looking at how they can actually continue with a bit of rent and also the clinical services to the drop-in centers. So that is an area that all of us who have drop-in centers need to actually look out for. Then lastly is, the conversations. If you bring up the key population aspect, so we went to men and women. So they actually say that, as key populations, we need to integrate or join our forces with the male and female engagements. So we'll need to actually now come up with a language that actually speaks to us so that we are able to actually work our goals through. So we, as Kenya, we did the, should I say, the populations country operational plan, and we do have various areas that we are actually saying the program needs to be, to continue, but these are our non-negotiable areas. We need to continue with provision of ART commodities for key populations living with HIV, and also the support to the drop-in centers. Service provisions need to continue. Then we need to continue scaling up support for additional peer cadres, especially if you have opportunities. Like in Kenya, we have the community health providers, the CHP. Can there be an inclusion of peer educators as part of the cadres? Looking at restoring and funding the KP-led service delivery, because in different counties, there need to be different priority settings based on the county conversations that are going, because you'll get that in Kenya, we are actually, health is a devolved function, so the counties are actually also in the lead. Looking at how we can train and sensitize the new healthcare service providers who are coming to take over the projects. And of course, ensuring that we have minimal service disruption with minimal commodity issues. And in Kenya, just winding up, is that we are actually now looking at how the best fit models when it comes to transition of our key population programs. So as Key Population Consortium, we are in conjunction with other KP leaders, we are now in conversations with the Ministry of Health and also the county persons into ensuring that we know which different models are there so that we can come up with a transition document, not an integration document, a transition of programs document to assist in actually ensuring that our programs see the light of day come the end of 6 months and also by the September 30th deadline. That is our scenario, and we will be sharing the Kenyan communities country operational plan with the organizers so that they can actually go out to everyone. Thank you very much.
Thank you very much, Solomon. And on spot, allow me to invite George. George, please come in, take the mic and share your experiences. Thank you.
Okay, thank you so much, Donald, and every other person that have contributed. So quickly for Nigeria, the issue we're facing right now is that we haven't really been briefed, but as a matter of fact, I, as the chairperson of the key population in Nigeria, have quickly reached out to the acting coordinator of PEPFAR Nigeria, Emerson, and he has assured me that soonest they will roll out updates to Nigeria as a country. So even this morning, we got off a meeting where he also gave that information to other CSOs, partners in the country. So we are keeping our fingers crossed to also be part of this process because there is a level of assurance to get us engaged. Quickly to the second question, the key population I would want to share for Nigeria is part of the country's sustainability plan because we have long ago plan on this whole transition thing, and the community itself is contributing to this whole effect. So I consider that Nigerian key population will be on the negotiation table, first of all, when there will be, access to budget envelope. We want to know what is involved and also know what is the priorities of the community that is in and what we should lobby for to be part of the saving services that would take up within the 6 months of this whole bridge planning process. So we also, as a matter of fact, want to also align with the CSOs and other partners to see that they collectively also support the key population in Nigeria, to see that our already developed priorities as a country also make its way to the services that would be involved in this 6 months plan. So we have a network of people, the people living with HIVs, we have the youth, and we also, as a matter of fact, we are trying to initiate, in fact, we've already initiated a conversation, an urgent community briefing with the CCM and other CSOs in Nigeria, which will happen on Friday, because we now know that it is urgent that we should race towards September 24th. So we as a community, we have already long ago planned and identified our priorities through our KP Cup that we held some time ago. And we are seeing that we channel our efforts, our advocacy efforts to see nothing is left out. So every other community organizations, we want to see that they are solidly behind us on the process and see that there is community inclusion in achieving health coverage. So lastly, I think it is good to also see that in our institutional strengthening and renewal plan, we have already prioritized the key population ask, the key populations concern in Nigeria. And we will see that even the government itself, through the NACA, through the Sustainability Technical Working Group, they already have our key priorities, as a country, because they also want to see that we are part of the sector-wide approach, that the community is included in, health and every other thing that has to do with security and health. So for us, we are following the process, and we expect very soon that PEPFAR
time is up,
come
George.
up with it. Thank you so much, Donald, and over to you.
Thank you very much, George. Yeah, you're indicating you have done quite a bit. You have engaged the PEPFAR coordinator in Nigeria, and you are assured that you'll be part of the process. Please continue pushing. Last but not least, I'll invite Kennedy. Kennedy, 5 minutes. Tell us the situation in your country. Over to you.
I do not think that Kennedy is in the house. Kennedy Mutale.
Or Kennedy is not in the house. So colleagues, we have had the situation in Kenya, and we also have had the situation in Nigeria with regards key population. Apparently, there's been limited engagement by the PEPFAR offices, so there is need to continue the advocacy engagements and the advocacy efforts. So as we move on with our webinar, I will invite Dr. Richard Muko to lead the general discussion, Q&A, as well as an interactive section. So there's a session so that at least we then can engage. So over to you, Dr. Muko.
Thank you. Thank you very much, Dr. Tobayo, and thanks very much, Asia, Francis, Tandy, and Munya, Solomon, and George, and Lizzie. Lizzie is basically leaving for another session, so I will be continuing on as your moderator until we finish this particular session. Now I will be inviting, this is basically the time for discussions. So since the time is not so much on our side, we'll start with the questions that have been posted. And of course, I'll read them, and in case, and then we can be able to see. The first question to Asia is about the presentation you've made. And of course, there is this document, 21-pager document, that you spoke about. That is a question from Nga Tendewisha. And of course, according to Nga, he's basically seen only, or maybe they have seen only the 4-pager and the 13-pager you shared. So maybe the question here is how many pages?
I've shared the link, sorry, not to cut you, but I shared the link in the chat to where you can find the Kenya example and the presentation as well. Over.
And then to Munya, how can we connect with the speakers at country levels and to support advocacy in Zimbabwe, Malawi, and Tanzania? Maybe Tendewisho, you'd like to come off mute and discuss about and maybe explain. I do not know how to make that happen. Munya, are you able to take over this question?
Thank you, Doc. So, like I highlighted, we reached out and we keep pushing. What we can do is, I think I can share my email address in the chat box. So those that are interested in being part of a process, once we get from the country team in terms of how the engagement will unfold, we'll then reach out to everyone interested. I hope that suffices. Thank you.
Thank you very much. Yes, you can reach out to Donald. Also, you can reach out to Francis and Tandy. Kindly The three of you can basically share, and of course, you can also reach out to Solo and George so that they can also share with you, especially for the key populations, on how the KP COP was done. So let's see if there is anything. There is also a question here from Odiambo. There's a need to develop a tailored transition and sustainability approach for key populations in partnerships with KP-led community-based systems. Rushed transition of criminalized population in government systems without their support over the years has been counterproductive. And of course, Evans has also provided an email there. Thank you for that comment. Let's see. Okay, all right, yes. Also, yeah, sorry, Nga, because I think I'm not also able to unmute you from my side here. And then there is a question here in Kenya about the young population. They are coming up. What is the way forward? How can we help? Okay, this is basically about how to assist the key populations or whatever. I will just refer you to, I'll refer this to Solomon from Violet Muher.
Yes. Do I go ahead and answer?
Yes, please.
Yes, so with the young key population, you'll get that there were the lift up funds that were actually done, I think it was last year. So the work for the YKP was actually documented, and then, but it was only bridging funds, so it was only for 1 year. But moving forward, what we are doing is we are actually coming up with the key population or the key and vulnerable population guidance, which actually encompasses the young key populations. And for us, young key population is people above 18. So we are saying that the guidance is actually for people above 18, just to safeguard the program. And you'll get that even in the country operation plan, the one we did for communities, we did actually ensure when doing the costing that it will actually take into consideration the young key populations. And you'll get that with this costed work plan, because it's actually costed, you can actually look at how much the KP program actually costs for Kenya. We will be rolling out the rest of the 13 countries as well. So we did the community country operational plan with GBGMC, that is the Gay Black Man Connect, and then with Health Gap and the KP Consortium. So all the information is there. We will be pushing, of course, to ensure that the KP program is funded. But as of now, we are not so sure if whether there will be, like a ring-fence funding, which we are not so sure about. But that is something we can also continue discussing. I will leave my email in the chat so that we can actually continue the conversations. Thanks. And I have put the document in the chat. Thank you.
Thank you very much, Solo. I go ahead. Somebody else wanted to comment on that? George?
No, not at all. Not at all. I think I've already responded to a question on the Q&A.
Thank you. And then from Hamdio, is the PEPFAR bridge planning for all countries, Asia, to you?
That's our understanding, but countries are being treated differently. Also, it seems like, and because there's no transparency, it's hard. That's why we need to all work urgently to gather this information. I just wanted to draw attention to the link that Solomon pointed out. I don't think it was coming in the chat, to the plans that he referred to that activists convened by GBGMC. I see Maureen Milonga's on the call with engagement from KKPC and Health Gap, developed in part to inform this planning process before we saw it would be the kind of emergency that it is. So please go to that link to appreciate the fruits of the labor of KP leaders from across dozens of countries. The fear is these will all be explicitly rejected as not waiver supported activities, which is exactly why we all need to push back, particularly if you're not from a KP organization, making space for those KP demands and ensuring that KP activists are brought to the table.
Thank you. From Ricardo Walters, clearly this is being positioned as an administrative exercise for the US government, not as a cooperative or collaborative exercise with the responders and implementers. Our government ministries the better targets for advocacy about this inclusion and participation and representation rather than PEPFAR GHSD that will simply comply with the HQ directive. I think you had also indicated exactly in your 5 pointers for advocacy Asia. Maybe you would like to comment on this, Ricardo Walters' question.
Let's definitely include ministries of health, their situational allies in all of this work, because certainly in many countries they'll have been kept in the dark too, but they might have more or different power or access to power than we do.
Thank you. And then there is also from Halima Lila. Thank you for the webinar. With all this is going on, we're seeing that there's no sustainability of knowing what will happen now and in the near future. As CSOs, what mechanisms are we using or are in place when it comes to resource mobilization to foundations, private sectors, and governments? I don't know. Maybe this one here can go to any of the panelists. Who would like to take it up? Any, especially from Compass and from the KPTNC? Munya, would you like to take that on, the question from Halima?
Apologies, I didn't quite get that one. I was still trying to digest it.
Okay, all right. Okay, Francis, what mechanisms are CSOs using to ensure that, of course, they are pushing for resource mobilization, you know? Or
specifically for PEPFAR discussions, in most cases, as CSOs, we try as much as we can to make sure that those community interventions are part and parcel of what have been funded, because by that, it means eventually we'll be in a better position to implement those particular interventions. So if we don't engage meaningfully in PEPFAR planning processes, it means the chances of the community interventions to be included in the fund are very low, you know, and that means eventually we'll not be in a position to implement, because there are those interventions that purely are always led by the governments, and there are those that in most cases are entrusted to these big organizations, the implementing partners. But specifically for community-led organizations, we have our own activities, I mean, nature of interventions that normally in most cases we're the ones leading them. Just to give an example, if you're talking about CLM, once CLM is funded, we do not expect the government to lead the CLM or the IPs. You know, that goes straight to those CSOs and community-led organizations. The VPR, the same applies to many other interventions. So to conclude, I think it's really important to be in these discussions as well as to the Global Fund related planning discussions to make sure that the community interventions are there, they are supported. And I think that is what we are trying to push as much as we can here. Yeah.
All right, thank you. There's a question from Ricardo here. And are there any indications that at country government level structures like NAC that have stronger civil society linkages are being engaged and included? And whether other institutions like Global Fund, PMU, CCM, or UNAIDS are at least aware of this global, this bridge plan process and timeline. I think this should basically go to Asia.
I don't know. I mean, this is all putting out so many fires. We haven't had time for a comparative analysis.
Okay. And of course, I think maybe in the coming days, could you be able to do that, Asia?
No, sorry. The priority is helping activists connect with targets to get them to stop and do at least what Mozambique is doing. That is a minimum demand, that civil society be convened, that everyone go to that meeting. So I think that I understand where Ricardo is coming from, but I think a comparative analysis is something that'll be much more helpful after the fact you know what I mean? But right now we're trying to change outcomes.
Yeah, it's a bit complicated, but of course, maybe we need to get in touch with the NAC, and processes, in our own countries, the CCMs, to see exactly how they are being engaged. And then there are quite a number of questions. Who should we be emailing at the PEPFAR? Of course, the PEPFAR country coordinators. And what are their emails? I'm sure at the country levels, in case you are in the country's CSO networks, you should be able to get that. And then from SNAT, we will reach out to Kennedy. So we do not know exactly what happened because he was not online. And then when it comes to communities, faith-based communities, we know all funds, they will be the last standing. How do we engage? Yes, it's important, of course, within countries that we work with the faith-based communities, the entire spectrum of CSOs. And then, I think basically we have that because our time is basically nearly up. I will invite Munyarazi to basically, first of all, I will invite Munyarazi and of course to give us exactly some important action points, and then Asia, and then of course, Donald to close the meeting. Munya, please come in.
Thank you, Doc. So I think top of the agenda from the way I've been listening to the contributions is that we need to mobilize communities in country and civil society organizations. And I think it's important to galvanize this level of support so that we can have a robust engagement framework. So I would propose that those that are within us who are part of networks share email addresses and contacts, reach out and make sure that we come up with a robust position. Then number two, I think it's important then from this house to come up with a position that will then be used by those countries represented here. As I speak right now, I'm sitting in the room on this webinar with one of our colleagues from Uganda, Ken, who has been on a call since morning. And on that call was their country PEPFAR coordinator, who has been quite engaging. So the question is, why are the PEPFAR coordinators of the other countries that have not engaged, not engaged? So it means it's an isolated case. These are isolated cases of poor or non-engagement, and we need to quickly do something about it. And then the last one speaks to us then developing priorities based on the emergency measures that we have put in place. And I think this is important. I know we are running out of time, so may I also propose that those who feel that they have more suggestions, with your indulgence, Doc Muko, to then throw them into the chat box so that we can harvest them. And then when we do our position paper, we can then synthesize, screen, and then come up with a robust position. Thank you, over and out.
Thank you very much, Munya. Thank you. Also, you have managed exactly to stay within the minutes, but there's Ken there. Maybe we can basically put Ken on the spot just for 2 minutes to hear from him how the whole process is in Uganda.
He has been eager to speak.
Sorry, as the speaker's being turned on, I just wanted to draw your attention to Saiti and Maureen's hands. Maybe you can't see them. Apologies for the interruption.
Who, I did not hear you, Asian.
Sorry, Maureen Milonga, Primrose Sundai, and Saiti Jata all have their hands up in the chat.
I was just reading the comments. So maybe I can just go on. Maureen, maybe we could start from Ken, and then Maureen. I will not take maybe more than that because our time is up, and then Ken.
So thank you, and hi everyone. So for Uganda, it so happened that we had a multi-stakeholder meeting discussing continuity and resumption of CLM, but the PEPFAR coordination office had reached out wanting to communicate the new transition, 6 months transition period. So we had a detailed discussion and clarity. Though there are still some questions, but at least we had many of the questions answered around that transition period. But there is also still uncertainty. I think what they have is still very brief, but at least we had that engagement. Over and back to you.
Thank you, and sorry, Maureen and Sati, I was not looking at the hands. So I will begin with Saiti. Please welcome. 1 minute, in case you can manage. I don't know how to unmute, because it's like, is there Richard? Are you still there? Richard from Ianaso, you can help us unmute. Anyone?
Can you invite them as panelists?
I can't.
Click on the names here, maybe.
Yes, I'm clicking. I'm clicking on the names, and what I'm getting is just chat and report. Just that.
I think the host is the one who can do that, and Yanaso, the one who's using the Yanaso account, is the one who can do that.
Hi, Yanaso, are you still there?
Yes, please. Hi.
Yes, could you help us unmute Maureen and Seti?
Okay.
Hello. Are you okay? So please kindly hold on, the two of you. Meanwhile, they're unmuting them. I could indulge you, Asia, and then we come to them when the process of unmuting has been finished.
I'd actually like to suggest that we have maybe a more interactive discussion that's about, that's sort of part 2.
Yes.
That is about real-time support.
Yes.
From groups engaged.
Mm-hmm.
And we can actually use the change call slot. Was supposed to initially have been canceled for tomorrow, but because of this emergency, I think many of us would like to maybe use that space. So I'm going to be in touch with groups about that, because I think we've really only scratched the surface. And we can maybe even have a more practical kind of workshop approach rather than building out now that the webinar has happened, so that it's more maybe of a collaborative workspace to try to test some of these things out. Over.
Thank you. Okay, Maureen. Maureen, you have been permitted. Kindly.
Hello, everybody. I hope you can hear me. So my name is. Thank you. My name is Maureen Milanga. I'm the Director of Policy and Advocacy at GBGMC. As Asia and Solomon was saying, we saw some of this coming, and we worked with partners from 11 countries 20 countries to come up with community-led country operational plans. So our version of what we expect a country operational plan to look like for key populations, especially because we recognized that the programs that were likely to be the most affected were key population programs. And as shared by Asia on the chat, please do look at those. Even if you are not part of those countries that we worked with, those are really good quality documents to use when you are talking to your country partners and you're talking to PEPFAR, because they have when we looked at all of the countries, there was incredible similarities across countries of things that had been cut and the non-negotiable priorities that communities wanted. And so probably this reflects what you probably want in your own country as a key population person. So looking at those documents and using those documents to craft what you would like to say to your country partners is really important. Second, probably the likelihood that if your PEPFAR partner hasn't called you, the likelihood that they probably will not call you. So we need to reactivate all of our government contacts. The people at the Ministry of Health, we sit in those TWGs. We sit in those Ministry of Health meetings. Those same people are the people that PEPFAR is contacting to have a conversation with. So how about if we bypass PEPFAR and we go and we talk to national government and we tell them, you cannot run these programs with what they are giving you. This is why we have this. This is what you should have also as your non-negotiable, because we are telling that to PEPFAR as well. So then we have somebody else who's saying that from another place, not just us. Then if you are on this call and you're a person who has been contacted by your PEPFAR country team and you haven't written that on the webinar or the chat, please do write to this team and tell us PEPFAR has contacted me so that I will be part of this meeting, because then that means that the people like us on this call can be able to support you when you go to PEPFAR and you're having a conversation with them. We are happy, we are willing, we are ready. We will sit on you with calls and we will prepare you, because you'll be taking on an incredible task when you go there, because there's very little funding and very little space for civil society anymore. I think I agree with Asia on a second round of calls. I think it's critical. We need to have a lot of these calls. Let's please join those calls. And we'll probably also reach out with regard to a key population specific call, because for key populations, the situation is dire. From the countries we have seen, they have decimated that program. So whatever is being written in those countries, our key population community groups cannot implement because we don't have any key population infrastructure. So we will reach out to you, but please use those documents, look at your emails, be ready to have a lot of really honest conversations with us, and let's move this forward. Thanks.
Thanks a lot, Maureen, and I'm really sorry because I was not looking at the hands raised. Saiti, and then I don't know, Brian, we might not be able to take one more speaker. In case you can just type. Saiti, please come in. Are you there? Saiti, can you hear me? Kindly, Saiti Jata, can you hear me? Okay, then maybe we can jump to Brian in case you are able to permit him. Because, okay. Someone from Yanaso, please help us do that. Okay. Yes, Brian, you have been permitted. Kindly.
Yeah, thank you. Thank you so much. Not to belabor what has already been said, and just recognizing that our time is running out. I just wanted to share some two bits of information some information that we learned in Kenya today that could be useful for folks as you're having conversations in your respective countries. We learned that PEPFAR seems to have set some allocation for land prep. They didn't tell us how much it is, but they were very clear that they have the same arrangement as the Global Fund. And so the resources for the rollout would likely be separate from what's been allocated into the country, to be slightly above, and it would likely match what's been committed by the Global Fund for Land Prep. So it would be great, as you're having those conversations, to be able to get that clarity from your end and to demand that as well. We learned that there's a little bit of flexibility that has been provided when it comes to rollout of PrEP. It seems like PEPFAR has said that they are willing to expand access to PrEP beyond just pregnant and breastfeeding women, on the condition that it is provided in the Ministry of Health policies. So we have to make sure that our in-country policies for PrEP rollout include key populations, because that's one of the ways in which we're able to ensure that KPs are able to access Land Prep as well. But beyond that, since we've already talked about how the KP program has been decimated in this new guidance and across the various countries, we definitely need to push back on this and cite all the various, just how this is going to impact the KP program, all the gains that we've made over the last 20 years or so. And we shouldn't be too quick to accept that, the integration agenda, we've seen PEPFAR in Kenya is really trying to push KP programs to be integrated. They're focusing so much on the journey towards self-reliance, and we know that's a problem. And we're not seeing PEPFAR clearly outlining what their role will look like in making sure that across the continuum of care, quality is safeguarded. So we definitely need to make a strong case and to push back on that and cite all the gains that we've made, all the human rights barriers that are determinant when it comes to KP programming, so that we make a strong case in preserving KP programming as well. Thanks.
Thanks a lot, Masharia. Saiti, are you still there? Okay. Saiti, okay. Thank you. Tomorrow, as you have heard, we still have the change call to follow up on this. Asia will share the link. I'm sure. Is that the case, Asia? Okay. And then
yeah, it's in the chat.
Okay,
it's already in the chat.
Thank you so much. So kindly help in sharing that, so that colleagues who may join that particular call just as a follow-up to this. And then lastly, let me just invite Donald to close officially, and then we can go on. And thanks a lot for all of us for joining this particular call.
Thank you very much, Richard, and a big thank you to all of you colleagues. I at one stage saw 360 people in the call. I want to appreciate our presenters, Asia Russell, we much appreciated, Lizzie for moderating, Munya, Tandy, and Francis for also speaking to the issues. George, Solom, you were eloquent around what is happening at country level. We want to appreciate all of you. I want to appreciate Ianaso for hosting this webinar and for ensuring that this is seamless. And I want to appreciate every country, every CSO and community that is pushing to ensure that the communities are not left behind as these processes are happening. And we define the key priorities that are critical, in this space. So I cannot mention everyone by name, Dr. Muko for coordinating the process. So Health Gap and all colleagues, I want to appreciate you. So tomorrow, like Asia indicated, we'll then do a deep dive through the Change platform, and the details have been shared in the WhatsApp platform. We'll continue to have more of the link being shared across different groups. So let's engage, let's get to engage with our country PEPFAR coordinators or different allies and networks at country level, and ensure that as we go into the meeting tomorrow, we also share those experiences, and we also share what is working and what is not working, so that we can improve this advocacy. But otherwise, we are over time, but I just want to appreciate and say thank you, and take care, and have a good rest of your day, afternoon, evening, wherever you're coming from, or wherever you're joining from. So again, thank you, and bye for now.
Thank you very much indeed, and thanks to Ianaso. You can close the meeting. Thank you. And you're free to leave also.